Hi everyone, we're back for another episode of Recovery in 20. I have Chief Clinical Officer Dianna Sandoval with us again. She was in our first episode about spirituality. Dianna is our resident brain spotting expert. It's a treatment modality that I had never heard of before I came to Aspen Ridge. So I figure if I have lots of questions about it, then our viewers probably do too. So
Right.
thanks for joining and doing this again.
Yeah, thanks Steve for having me. I'm happy to talk about brain spotting. I think there's a lot of people that don't know about it, and it's a really powerful technique.
Is it super common in the treatment world? Are a lot of people trained in it?
Not really. I mean, it's on the rise for sure, and there is data to support the efficacy of it. So it's leaning into best practice. There's about 20,000 therapists trained in it. There's about 65 trainers who train trainers. So it's growing, but it was discovered by Dr. David Grand back in 2003. So it's not a new practice. It's been used for a long time, but it's gaining more momentum now in a broader scope with therapists. So it's pretty exciting.
So it's a brain based. Correct me if I'm wrong at any points.
Yeah.
It's a brain based therapy, and that is opposed to a talk therapy, which most
Correct.
people are pretty familiar with. Think Sigmund Freud.
Yep.
What happened in your childhood.
Yeah.
General therapy.
Yeah.
So what is a brain based therapy versus a talk therapy?
So basically, the power of a brain based therapy is that it goes beyond the mind, right? So, this neocortex, the front of the mind here, the front of the brain, that's where we do our conscious living. That's where our words come from, our analytical problem solving, all of that happens up here. Brain based therapy kind of bypasses the mind, the conscious, and drops down into what we call the subcortical or the limbic part of the brain, and it gets to a place that talk therapy could never get to. And that's the power of it. Like, that's one of the main significant differences. Brain spotting is intended to be used in collaboration with talk therapy and other techniques. It's not a standalone, but that's why I like it. It's an integrative model, but it'll go where words can't get.
So it's primarily for treating trauma. Am I correct on that?
It actually was discovered with during sports therapy. Performance therapy is where it was.
Interesting.
Yeah, that's where it was discovered. So Dr. Gran was a well-seasoned EMDR therapist, and he was working with a client that he'd known for some time, and she was a professional ice skater, and she was trying to do, I think it was like a triple axel as part of her routine. Every time she got there, she would freeze and couldn't do it. So that's really where it began. And when he was talking to her about it, he noticed when she would talk about that particular move, she had some very, very responsive physiological observations. Like, he observed physiological responses to it. And that's really where it was born. What it's powerful for is definitely trauma, and it's trauma release or trauma reintegration. So if you
And
have
what are those two things?
yeah, so trauma release is the idea that you could actually resolve a trauma, and that it could be finished, right? Trauma reintegration is the idea that people have layers of trauma, complex trauma, and some things just aren't resolvable, but you can reintegrate it in a way that it doesn't constantly get activated. So you could recognize, oh, I had an experience that was familiar, but my response was quite different because I deactivated that trauma capsule. And that's how you reintegrate, that it lives there, but your relationship with it is different.
You mentioned the trauma capsule. So give myself and people watching a basic overview of how brain spotting works and what it is, the visual element.
Yeah, so super simple. I'll explain it in that when an event happens to us, we process everything up here in the neocortex part of the brain. Like, I want to understand it, right? You hear the term, I want to wrap my brain around it. Well, when something traumatic happens, the mind will process as much as it can, and what it can't, it sort of capsulizes and it drops down into that limbic system. So what brain spotting does is it uses the field of vision to find the spot where that trauma capsule landed in the brain. And then by connecting that, we do a somatic check because muscles have memory, and so it's really about creating a framework where the brain and the body gets connected and resolves or reintegrates the trauma, because that's what we're organically designed to do. What happens is that when that trauma happens and that capsule drops, the brain and the body get a little disconnected. So the muscles are storing memory, the brain is storing trauma, and we just need to get that reconnected so that it can be resolved or reintegrated.
So when when you're sitting with a patient in a session,
Yep.
How do you spot those capsules? I know it's something to do with the eyes.
That's right. Yeah, so the idea is that where we look affects how we feel, and the retina in the eye is called an embryonic extension of the brain. The retina is actually the same tissue as the brain, and so where the eyes are going, the brain is responding, it's activating. So what we do is start with a very, very basic technique. It's called outside window, and we have the client identify a topic. How activated do you feel? Where do you feel when you talk about that topic? Where do you feel that in your body? So they do a quick scan, and then we say, okay, let's find the spot that connects it. And so we'll start here, and then we will go to the left, and then we will come back to center and go to the right. The client will say, oh, there's something there, right?
It's wild.
It's really wild. And it's amazing because even if the client doesn't identify something, I can see it. And when people hit a spot, there's all these things that happen. They swallow, their throat gets thick, sometimes they'll twitch, sometimes their eyes will begin to blink more rapidly. They're not even aware. Sometimes their eyes will wobble a little bit, which is notable in EMDR, that movement. But as a clinician, you're watching that neurological response to looking for those spots, and so you can see them. And so you might stop and say, what's happening for you right here? And they'll say, I don't know. I feel something. I don't know what it is. That's a spot. Sometimes a client can feel it themselves as you're moving. They'll say, oh, something's there, and that's called an inside window. So yeah, the eyes are the window to the brain, right? So that's where we make the connection.
When they get to that insight window, say you're talking about something that doesn't seem, traumatic or related at all.
Right.
What happens then? Do you say, hey, I saw your physiological response. Is there something there we need to discuss? Like, do you guide it that way?
Yeah, a lot of times you'll say, well, is there something happening for you there? And they'll say, yeah, I kind of feel something, and so I'll say, okay, well, let's hold that spot for a minute. And the interesting thing about brain spotting versus EMDR is the rapid eye movement, and it's a therapeutically guided journey through a particular trauma. For brain spotting, it's not about movement, it's about focus. Like, we will find a spot, and a client will go through multiple different capsules in their brain, and we just hold the spot. Like, that becomes the anchor for them. But then it's like turning your cell phone camera around, and what we're doing is we're turning the field of vision inside, so the brain is scanning itself, and it's going to travel. I've had clients travel through 4 or 5 different traumas and connect those threads in one episode, and I'm just holding the pointer, and they're going where their brain needs to go. So it's organic. The brain knows what to do. We just have to create framework for it to do it.
That's really cool.
It's amazing.
I had Danny on a couple weeks ago, and we briefly touched on it, and I had to admit to him, when I first heard about brain spotting, I was a little skeptical. I was like, this sounds a little wishy-washy.
Yeah.
Like, I feel like someone's gonna bring out incense and crystals, and and he said, no, I was absolutely skeptical as well, but no, I'm totally convinced that this is a real treatment modality that's evidence-based and that works.
Yeah, you know what, Steve, it absolutely is. I mean, it absolutely is. And the truth of the matter is that nobody in this world has escaped trauma. Now, it could be small traumas like a little t or a big T, it could be complex trauma, but the truth of the matter is that we've all experienced it. And the issue is, if there's a way to release it, because that's what we're organically designed to do, we're not designed to mount it up and carry it around, right? Then that's what we want to do. And so to me, brain spotting is a natural alignment with what the brain and the body were intended to do. And we just create framework for it. Anybody can benefit from it. And it doesn't have to be a traumatic event. A woman talked about, like, I'm grinding my teeth and I don't know why. Did brain spotting on grinding the teeth. Never identified the actual reason she was grinding her teeth, but she quit grinding her teeth. And so anybody could benefit from it.
It's just really neat. The whole thing is just really neat.
It's cool. I'll do one for you.
Oh,
you
okay.
Try a session.
Yeah, I'm absolutely. We can throw it on.
We could do it. You can go on YouTube and look at
Oh, really?
Oh, sure. And I encourage people to do that. Like, it's a curious thing, but once you get exposed to it, like, it's amazing. I've never seen it not work. Never ever seen it not work. Like, it changes internally what words can't get in and redirect. Yeah.
I'm absolutely down for that. This might get into the little bit more technical, but I know there are 4 techniques for that, for brain spotting.
There are many techniques. There are 4 basic techniques.
Okay. Could you walk me through what those are?
Sure. So the first one that you would learn in a phase 1 training is the outside window, and that's the one I was describing, where we hold the pointer, we go left, we go center, we go right.
So it's like any kind. It could be a pen.
It could be a pen.
Okay.
It could be a finger. The problem is that you have to hold it, and so if I'm going to sit for 90 minutes like this, like, no, I'm too tired. So we use a pointer. It looks like, for those who are old enough to remember, car antennas. So you just sort of pull it up like this, and you position it. I position it on my knee, and then you can hold the spot for someone. And then the inside window, as I mentioned, is the one where you're moving the pointer and the client self-identifies and says, oh, something just happened right there. I don't know what it is. Okay, let's hold that spot.
Is it usually, when they say something happened, is it a physiological response, or could it just be, something a little bit more inside the head? Like, oh, I just had a twinge of anxiety there.
Yeah.
Any of those?
Yeah, any of those. Yeah, any of those. Usually I'll see it. Because there is a physiological connection to it, but the client themselves feel it, like, oh, I don't know what that was, or yeah, all of a sudden I feel anxious, or oh, my throat feels tight. And so they recognize something shifted for them. And so that's an inside window when they tell me where the spot is. And then there's something called gaze spotting, which is really, I do a lot of gaze spotting. Whenever I'm thinking about something, like, I'll look away. I'm having a conversation. I've probably done it with you in this conversation. And I just look down, or I look up, or whatever. Gaze spotting is a natural place where we go, and we just sort of lock onto something. Sometimes people do it because they're thinking, but actually that's a potential spot, a brain spot. And so those are the first 3. And then you just you don't use the pointer. If somebody's staring at something, you say, I noticed during our sessions, you have a tendency to look down and to the right pretty often. Let's do that on purpose. I want you to just keep talking, but I want you to look down to the right, pick a focal point, and just hold that for a minute, and let's see what happens. Usually it's a gaze spot. And then the final one is called resourcing. And what I love about resourcing is it's your grounding place. It's your safe place. And so you can use resourcing in a way that gives people a sense of, if this becomes too overwhelming for me, I know I have a place to go back to. And that's really powerful. And a lot of times, like for addictions in particular, there's a setup called the crocodile setup. And there's a doctor in Australia who created this. But basically, in addictions, the brain we're pleasure-seeking creatures. The brain will separate the positive or the pleasure of using a substance with the negative consequence. So you can use a resource modality where I'll hold a pointer and say, I want you to look at the pointer and then go far beyond it. I want you to go past and pick a place on the wall. Maybe I put a sticky note or something up there, and that's where you feel good. That's where you feel safe. Then we move the pointer and we find that point of activation. And then while the client is processing, we have them go from activation to resource, and that connects the good and the bad so that they're not straddling two worlds. Because a lot of times in addictions, how many times do people say, I really genuinely don't want to get high again? And then they do. Because there's a barrier that happens between what will feel good, because the brain is a pleasure-seeking vehicle, to the consequence. Those two things oftentimes get disjointed. So brain spotting can connect it.
That's really interesting, because I mean, I know even in my own recovery, like every once in a while, it doesn't happen often, but I'll have one of those crazy thoughts from the little guy that's still hiding back there and be like, would it be different if I had a drink this time? I mean, it's been 4 years. Like, you could probably, and my brain starts telling me those things, and I have to consciously stop and like play the tape. You've seen this movie. You know how this ends. Like, and it's a conscious step to connect those things in my head. It doesn't come naturally or organically.
No, that's exactly right. It's not organic. We don't typically connect good and bad. We go for the good. And we will also do the bad if we think the good outweighs it. So we'll do something bad to get to something better, right? And so this gives people an opportunity to have a safe grounding place that feels good, but then to bring in the negative and be able to connect those things so that they can kind of see the big picture. And create some resolution for themselves around the addiction. And just real quickly again, it's really intended to be used in conjunction with all the other skill sets that therapists have. Like, it's not the be all end all. I love it. I'm doing it with most of my clients now in my practice, but I do it in conjunction with talk therapy and in conjunction with experiential therapy. And that's what I really love about it, is that it just makes a clinician more equipped to go into a broader space to partner with healing their client. That's what I love about it.
It's just, I keep saying it, but it's really neat to me and super interesting.
It's cool.
You mentioned that it was, it's evidence-based. It's been shown to be highly effective. I know that they used this after the tragic events at Sandy Hook on some of the survivors. Can you tell us, what did they do, how that worked?
Yeah, so a community-based research group took several survivors of the Sandy Hook Elementary School tragedy, and that was back in December of 2014, and they said, how do we best support these people? Like, how do you even navigate living beyond something like this, losing a child in that way? And so what they did was they pulled together all the different treatment modalities that they could think of. They got a focus group, and I mean, they did art therapy, they did music therapy, they did talk therapy, like every form of therapy that you can think of. Because again, every form of therapy holds value. We don't know what's going to be the technique that's going to like really resonate with that client.
Yeah.
Exactly. So clinicians need to be eclectic. So they pulled together all these different resources, including EMDR. They did brain spotting with those folks. And what they determined in that study was that brain spotting had the most resolution or reintegration impact with those people and the longest term sustainable results. So once that trauma was identified and either resolved or reintegrated, it didn't trigger anymore. It was almost deactivated, you could say. And it was the most impactful form of treating PTSD of every other form of therapy that they tried with this focus group after that tragedy. Yeah.
And you said it was reintegrative, that they were, I mean, obviously it's, losing a child, that it's never going to be. So.
You don't lose that. Yeah, you don't resolve a trauma capsule like that. You can't. It will never go away. It is about being able to reintegrate the traumatic response to that so that you can appropriately respond and live forward from there. Like an example is someone with abandonment issues. somebody, maybe who didn't have the nurturing and the connection and the bonding that they needed as a child. Sometimes for adoptive children or neglected children or abused children or whatever. What happens when we're young like that and we don't form those healthy connections, then as we age in life and we start building our own connections, there's a real fear of being rejected, right? Like that's attachment. And so, for somebody who has some abandonment or attachment issues, and let's say they're an adult now and they meet someone and they make a connection, and then that person somehow doesn't work out, then the person who has the attachment disorder or the attachment issue can just be unraveled, like the rejection, and it's deep. It's like, oh man, it's painful. It's not just like, oh, it didn't work out. It's like a deep sense of rejection. So for someone who does brain spotting around that, you can potentially go in and talk about the attachment, talk about the abandonment, talk about the experience, and they can reintegrate that in a way that the next time they meet someone and it doesn't work out, they're like, that's not, that's disappointing. I wish that hadn't happened. I really had high hopes about that relationship. But they don't have a come apart over it.
They don't go to pieces.
Yeah, they don't go to pieces. And it's because they reintegrated, they disempowered or deactivated the momentum in that particular traumatic event. And so it's kind of like sometimes people don't necessarily realize the power of it until they have an event that they can see. I responded very differently to that. Wow, it worked, and that's how it flows.
Such a interesting topic, interesting method of therapy, and the brain is such a definitely the coolest organ. It's wild the things the brain is capable of.
Yeah, it's an amazing machine.
It is. Well, thank you guys very much for watching. Thank you very much for joining me again.
Yeah,
I won't bug you for a while.
No, it's all good. Thanks for having me.
And if anyone out there is struggling with substance abuse, mental health, or trauma, you can give us a call at 855-281-5588 or visit AspenRidgeRecovery.com. We accept most insurance, and we are now in network with Blue Cross Blue Shield. So give us a call. We'll take good care of you.